and hygiene. Hi, Mr. Smith. My name is Maggie. I'm going to be your nurse today. I am actually just going to be suctioning out your trach and clearing some of those secretions out for you. Can I please have your name and your date of birth, and can I take a look at your armband? All right, great. Are you having any pain today? No pain? Great. All right, I'm going to adjust this bed up a little bit. Short. I'm going to take this tubing and place it on the patient. This is not sterile. Put these bed rails down, probably a good idea. Life easier. All right, and I'm going to open my sterile suctioning kit. Careful not to touch the inner contents of it. Okay. Now, I'm only going to be touching the sterile glove packaging. I'm going to perform sterile gloving. Starting with my dominant hand. Picking it up by the cuff. Should hopefully be an expert at this by now, but maybe not. Right, we'll need to readjust that, but that's okay. I can do that once I've already put on my other sterile glove. So under the cuff, slide your fingers under, and just slide your hand in. And now I can make adjustments because the surfaces are sterile. And this basin would be used for my sterile saline solution, which if I were to be using it, I would have poured it in before I put on my gloves, since the outside is not sterile, but the inner contents are. It would be used to rinse out the suctioning catheter. So this is the sterile part of the catheter, and I'm going to wiggle this around my hand to ensure it will remain as sterile as possible. And my non-dominant hand is going to become my dirty hand, and my dominant hand is going to be sterile. So, and Mr. Smith is an adult, so this probably could have been placed on a little better, but kind of sliding, but I know you're supposed to place it on the patient. Mr. Smith is an adult, so the appropriate suction, and I'm going to turn this on with my non-dominant hand, would be 100 to 120. Right, so I would just slide and connect with holding this with my non-dominant hand. And as I'm entering, I do not apply the suction, but I will enter into it, holding the calf with my thumb and forefinger. Apply suction while twirling it kind of between the two fingers, and for no longer than 15 seconds, but ideally 10 to 15 seconds would remove it. All right, looks like Mr. Smith's airway is now no longer has secretions. All right, so I'm just going to go ahead and discard my supplies. So I'm going to put up patient's bed rails, so the patient's all safe and everything. I'm going to lower you down a little bit, Mr. Smith. Right. Now, I'm going to Just on this. And then, all right, Mr. Smith, your call light is going to be right over there. Just call if you need anything else, okay? And hand hygiene and out.